All right, hello everybody, welcome. We're going to get started in just a few seconds, give everyone a little bit more time to get in here, and then we'll be on our way. All right, so I'll get us started. So hello everybody and welcome to this webinar, The Pandemic and Campus Substance Use, What Colleges Need to Know Now. Thank you so much for taking the time out of your busy day to be here with us. My name is Tracy, and I'm a program officer with the Trustee Department here at the American Council of Trustees and Alumni, or ACTA for short. I'll be working mainly behind the scenes for today's event. I'll be monitoring any questions or concerns that arise. And with that being said, I would now like to introduce our moderator today, Armand Alacbay, ACTA's Vice President of Trustee and Government Affairs.
Thank you, Tracy. Good afternoon and welcome. I just want to reinforce what Tracy said and express my own appreciation for your public service as trustees and as leaders in the higher education community. You are why ACTA exists. There's arguably no civic duty whose impact is greater on future generations than that of service as a member of a college or university governing board. So to put this in context, there are about 1,500 public and private not-for-profit four-year institutions of higher education in the United States, and about 23,000 volunteers who serve as trustees or regents in some capacity. So that's 23,000 volunteers across the country in whose hands lie the futures of tens of millions of college students. ACTA decided to put together today's program because we believe that the highest levels of college leadership must be personally involved in addressing campus substance use as colleges and universities begin to reopen. And the reason for that is that there simply is no precedent to rely on to confront the student mental health needs to come in the approaching months. I'm pleased to introduce our panelists for today. Dr. Robert DuPont, founder and president of the Institute for Behavior and Health. Dr. DuPont first served as the first director of the NIH National Institute on Drug Abuse and as the second White House drug chief. Dr. Amelia Arria is the director of the Center on Young Adult Health and Development and the Office of Planning and Evaluation at the University of Maryland School of Public Health. Dr. Ellen Rome is the head of adolescent medicine at Cleveland Clinic Children's and professor of pediatrics at the Cleveland Clinic Lerner College of Medicine of Case. And Mr. Caleb Boswell is a professional counselor and student advisor in the Office of Counseling and Career Planning at Washtenaw Community College in Michigan, and who's also the co-facilitator of the Collegiate Recovery Program at WCC. Now, before we begin, a couple of housekeeping issues. Our program today will run about 75 minutes. We expect to reach the Q&A section about 10 till the hour. In the interest of time, we do ask you to submit your questions through the Q&A button at the bottom of the screen. Also, please include in your question the your name, and the college or university that you're affiliated with, as I think we all would appreciate the range of perspectives present today. With that, let's get right into it. And so let's start with a question for everyone on the panel. So really two-part question. So by way of setting the table, when you hear the words student mental health and substance use in 2021, what comes to mind to you? And separately, why did you agree to appear on this panel? For this question, why don't we go in order of how I see it on my screen. So let's start with Bob, Ellen, Amelia, and then Caleb.
Well, the focus on drugs in particular, I'm going to leave mental health aside for just a second, is no accident that it focuses on college. If you think about the COVID epidemic, we've had a drug epidemic in this country. And if you go back and look at when it started on college campuses. Think about Timothy Leary and the baby boom population and how that was associated with a dramatic change of behavior. So we're into our fifth decade of another epidemic that was here before the COVID and will be here when that one is gone. And from the beginning to the present, the college has been ground zero for the drug epidemic.
I agree exactly. And with COVID and the pandemic, I had many parents and families thinking, oh, great, my kid's college experience won't mean huge parties and lots of risk. turns out kids are finding in college means many, many things now. And kids are finding their way to lots of opportunities for use of drugs and drinking alone and together. And as this pandemic has brought out the stress for many, many kids, and the anxious kids are all saying, "Oh, everybody gets me now," and as are the introverts are all happy that they're home, and the extroverts will use their moment of substance use as a window to let loose. Even if it's with 10 or less friends, they still may be doing things to excess. So, we'll talk more about that, but student mental health and substance abuse really do go hand in hand historically and now during this pandemic. And I'm so passionate about this topic and about creating havens on college campus for kids to be well, not ill, and windows of opportunity to open those doors and allow kids to flourish and shine and develop resiliency if they haven't done so already.
I would just like to echo what Ellen was saying about how there's so much variability in the response to the pandemic. I don't think that one generalization can give the complete picture. And what the research has shown is that the response, substance use as a response to emotional negative states is highly variable. And some students the good news is some students have really used this time as a fresh start and to engage in healthy behaviors. And other students have used substances in response. So we have both decreases in drinking documented and increases in drinking and other substance use. So I think that we need to identify what students have, what kinds of patterns going forward, and to make sure that we mitigate any sort of long-term effects of the change in the pattern that they had if it is a harmful one.
So I would say, in my opinion, what comes to mind when I hear that question is coping. A lot of our students are just dealing with a lot. And so the students that I come across, they're dealing with life two times. And what do I mean by that? You have what everybody is going through publicly with COVID, with restrictions, with all that other stuff. But then we still have life happening privately. And so it makes for a double whammy. And so what comes to mind for me is just coping and just trying to deal. If you look at it from a traditional standpoint, from a traditional sense of a student, these students have had their lives turned upside down. In regards to COVID. It is what it is. From our seniors who are going into college, who missed out on their senior year and prom and all that other stuff. And then even this experience not being what they envisioned. And so even though it's not all students, I definitely see it going hand in hand with mental health and substance abuse, really as a coping mechanism.
So, Amelia, we talked about this issue before, and actually, in light of the fact that a lot of the people watching us today are college leaders, right? And you talked about this intersection of mental health, substance use, student outcomes, and the importance of approaching them holistically. In light of our audience, could you speak to how all these issues fit together and your perspective on them?
Sure. Just real briefly, I think one of the things that's important to recognize is that the division between student affairs and academic affairs, that traditional division, it doesn't really serve students well when we are trying to deal with this holistically. So I have advocated for more crosstalk between the health center and people in academic advising to make sure that academic advisors are well aware that health issues can get in the way of student success, and that they have those resources available to them when they need them.
So all of this is against the backdrop of this pandemic. I mean, hence the title of the program. So Ellen, in your research, you've talked about this concept of maladaptive behaviors. So what does that mean? And what does it mean particularly today in college age populations since the start of the pandemic?
We think of maladaptive behaviors as coping strategies that are not particularly useful to a given kid. So, for instance, eating their way through the pandemic for the binge eaters, not eating their way through the pandemic for the kids with anorexia nervosa or the restrictive forms of eating disorders, drinking their way through the pandemic. Tons of kids smoking or vaping their way through the pandemic. And the particular challenge of that is, for instance, all of the vape things, 12% of kids don't even know what they're vaping or have no idea what's in it. The ones who are intentional about it don't realize the toxicity of what they're doing and are vaping what they think is marijuana, but not realizing that the vape device, especially if they overheat it using it as a dab pen, where the heating element gets more heavy metals and toxins pooling at the bottom of their lungs, exactly where COVID would further compromise lungs. They're not realizing the double whammy they're putting themselves at risk for. And on top of that, we see lots of kids who are stressed or anxious or depressed using substances to self-medicate. The bigger challenge here is they don't, one, realize that some of the substances they're using for a problem are actually making the problem worse. For instance, both alcohol and marijuana and opioids, all of those are body depressants. So that's not helping. And the other big challenge is they're not sure what they're getting. And so that leads to some of our deaths. There was just a kid who thought he was buying a benzodiazepine, a chill pill. And I think his was Xanax, and it was laced with fentanyl and he died. So this is happening on our college campuses as well as in our high schools and communities. And these are all preventable things. We want them to have more adaptive or positive coping mechanisms. And we can talk about that in terms of hazing or other things as well.
A lot of context. I mean,
Yes.
So Caleb, what are you seeing? So as someone who is working directly with students in recovery, is kind of what's the pattern you're seeing, or is there a pattern, or what surprised you, or what would surprise college leaders to know?
So we'll start with the surprise. I will say probably one of the biggest surprises that I've seen from students who are in recovery, those who are long on their journey, those who are committed to their journey, those who are along the way and are in a good space, typically tend to be great students. So a lot of the students who are part of the CRP program, the students who I've seen who have been in recovery for years and who have been maintaining it and who are serious, those are also some of our top students. I think of one of the students, I think it's called Jack Kemp, but it's a scholarship that's awarded. It's a scholarship that's awarded to community college students. It's a national scholarship. One of our people in the CRP was a regional finalist and went all the way to the finals for that scholarship. I have another student who flunked out of multiple colleges. But again, once he got along his road of recovery and got into a good space, he graduated from WCC with honors. He's on his way to, he was dual enrolled at another university while he was still at EMU. And then he's going to be a law student at U of M. So that's one of the surprises that I have seen, is that the students who are along the way in their recovery are really committed to school. I've seen that with many of the students. One of the things that we've tried to do during this time, during the pandemic, is with all this chaos, with all this craziness, is to try to have some type of normalcy. And so one of the things that we've done on our end is we've continued our weekly meetings. And so CRP, the Collegiate Recovery Program at my institution, meets on a weekly basis every Wednesday at noon. It's not like a meeting. It's not like a 12-step or anything like that. It's really just for a safe space for students to kind of congregate, who are in recovery to kind of come together. We do like a check-in, and then it kind of goes where students want to go. Sometimes things are more serious depending on where people are checking in at, and some things are really light. But it's kind of just that hour to kind of congregate and come together. We've still maintained those meetings by doing them virtually, again, just to kind of give students that sense of normalcy. And then the last thing I'm going to say is that one of the things that I've noticed since we created the CRP at my institution is that the great thing about it is that you see the peer support. So yeah, the college created a space, but what's even better is the peer support that comes along with the program. And so you see students who are naturally reaching out to new students who are getting involved. You see students who are reaching out to students who you haven't seen maybe in a week or two. I'll never forget a student who literally came in the weekend after St. Patrick's Day and had a relapse. And in that moment of coming in, he was brand new that day. I remember 2-3 students saying like, hey, this is my name, this is my number, I go to meetings on this day. And so the thing that I love about it is that it creates a great sense of peer support that as a staff member, I don't have to do. I don't have to juggle that. I don't have to worry about that, because the community that we've created creates a great sense of community and peer support amongst the students.
So we talked about this recovery community, and also, Kelly, you brought this word normalcy, which I think is in short supply really in 2020. Mm-hmm. So Bob, though let's talk about a different type of using the term normalcy. You've been a strong advocate for a long time for denormalizing college drug and alcohol use. Actually, you have data to refute the claim that quote, everyone does it. So there's the how do we parlay that into a message that college leaders can use that will resonate with students?
Well, thank you very much. And I appreciate that. Absolutely, to denormalize it. But I wanted to say a word about what we were talking about before to get us started. And that is, people use drugs because they're unhappy, but they also use them because they're happy. To think that people are using them for medication is completely wrong. They use it for everything because of the way the drugs work. The drugs superstimulate brain reward. That's just biology for it. And what we've got is a situation where it's they thought it was normal to party. That's the word that is involved in the colleges, it's toxic. This is not any kind of sensible behavior at all. And as you're saying, I really want, to me, the issue is the normalization. It's the expectation that people are going to use drugs and alcohol for whatever reason, to party, to have fun, or to deal with insomnia or for social anxiety or whatever in there. And you were mentioning about our data. What we've shown, which is new, is that young people in America for the last 4 decades have increasingly made the choice not to use any alcohol, any marijuana, any other drugs, any nicotine, any vaping. And that number has gone up for high school seniors in the United States in 1983. In their lifetime, 3% had never used any drugs, 3% in 1983. Last year, it was 31%. Okay, in 1983, 16% had not used any drug or alcohol or nicotine in the last 30 days, 16%. Last year, it was 59%. This is a tectonic plate change. It's huge, it's enormous that's been going on in the United States, and it's largely been overlooked of what's going on. And to me, what needs to happen is, first of all, like we celebrate recovery, we need to celebrate the decision not to use. All of these uses are unhealthy and unwise and dangerous. And the normalization of drug use is pathological. We use the word stigma in our field, and stigmatizing. Think about what we've done with cigarettes. We've got the cigarette level down largely by stigmatizing smoking. Everybody knows it's unhealthy to smoke, whether you're using or not. And what I like to say about that is, you stigmatize the unhealthy behavior, not the person. The behavior is unhealthy, not the person. It's the behavior. We feel that way about smoking. I don't think most of us think smokers are bad people, but we know they're doing something unhealthy, and we giant march tell them. And I think that's what we need to do. And I encourage everybody on college campuses to denormalize partying with drugs. Let's find ways to party that don't involve using drugs. And also extremely important to think about what partying means on college campus. What kind of alcohol use is that? That's using alcohol till drunkenness. What population do we think that's a normal, healthy thing to do or fun? It's clearly unhealthy and pathological. So I think we need to do a couple of things. One is recognize the large number of students who made the decision not to use anything. Oh, and the other thing from our data is that all the drug use is related. We don't have an opioid problem, an alcohol problem, a nicotine problem. Those are all together. It's one problem. It's the use of chemicals to superstimulate brain reward. It's simple as that. And to go at it issue by issue is dumb. But the media does that. A lot of our treatment is like that. No, it's all together. If you look at the opioid overdoses, all of them have other drugs on board when they die. There are no people who are opioid users who don't use other drugs. They do not exist. But that's true for everything. So whenever a young person is using any drug, the probability of using other drugs goes way up, 5, 10, 20 times more from the use of any other drugs is like that. Alcohol is like that. Everything, cigarettes or marijuana, it goes together. And we need to recognize that and to denormalize the use itself, that it is not healthy. We don't have to put people in jail. We don't have to throw them off campus, but we need them to understand that it's unhealthy behavior. And what's happened instead is we've normalized partying with the drugs and alcohol. And that's not healthy. That's not good for the students. That's not good for the universities. That's not good for their health. So that's my message.
So Bob makes a really good point. And I want to throw this question to the group, actually. So, we've talked about people using drugs and alcohol as a way of coping, but then also there's this issue of using it to celebrate, right?
Yes,
so
that's right.
if you are, so a question for, and please everyone jump in. If you're a college leader right now, well, what concerns would you have or should you have as we reopen campuses and people are able to students celebrating the end of pandemic lifestyle, whatever it is, right? Like what kind of guidelines would you give? What kind of concerns would you have? Or do you have?
I mean, one thing that we have been trying to prepare college leaders for is the fall, where two things might be happening. Students who have decreased their drinking tremendously for healthy reasons are going to come back to an environment where they might have the opportunity to drink a lot and very quickly. And in Italy, there's some data showing that there was a rebound where people had alcohol poisoning because their tolerance was so low. And so in the very beginning, there might be this need to identify students who might be at risk for, like in Greek life or in settings where that might happen. And there's no way to predict. I mean, we don't have a pandemic playbook that we can pull out of our back pocket. So we really don't know, but that's one thing. And the other is that college students will find ways to celebrate the end of the pandemic, and that might coincide with going into the fall. So making sure that the message is given from the top, that policies will be enforced, but that students, like Caleb said, are given a safe space to talk about their experiences during the pandemic, that faculty actually are part of the conversation with students to say, this is a new normal. We've just been through a collective trauma here, and we want to make sure that students have an opportunity to share what they've gone through so that a student can identify a student who might need some help. A faculty member could identify a student who might need some help, a coach, that everybody has this collective responsibility to identify students who might be struggling with the adjustment back to college life. That way that if, like Bob said, if they're socially anxious and they use alcohol to make them, feel more comfortable in a social setting, that somehow someone else recognizes that they might need some help. Because we know that educational programming does not work to prevent substance use on college campuses. That's the other thing college leaders should know. You can't just say, this is risky, don't do it. That we've tried and it doesn't seem to work. It's got to be a one-to-one conversation to identify the person who might need some help.
Did you want to speak? You were unmuted for a second.
So I was going to say, I agree definitely with that second portion of it definitely needs to come from the top down. I think it needs to be bigger though, and this is my personal opinion. I think it needs to be bigger than just substance abuse in regards to what it's going to look like for students coming back to campus. During this pandemic, students and people in general have just gone through a lot. And numbers across the board for a lot of different things have gone up. And so, things that we've looked at in the counseling world, you have people, because you can't go to work, because you can't go to school, now you're stuck in the house with your abuser. And so you see shelters overflowing because they can't deal, with the things that are going on from the pandemic. You have individuals who, one thing that, I stress in my own job is about giving students some grace. Because you have students now who, in some cases, have gone from being normal college students to now they're caretakers. They're taking care of their younger brothers and their younger siblings while their parents are off at work, and then trying to adjust back to that. And so for me, I think the bigger picture is creating a space on campus that promotes mental wellness, that promotes using mental health services, that promotes, it's okay to not be okay, and to promote better mental health services. I understand that we're talking about substance abuse, but a lot of students during this pandemic, it's layered. One of my favorite lines from a movie is Shrek. And it's when Shrek says, ogres are like onions, we have layers. And so there are layers to these students. And that, just because a student may have used alcohol or may have used marijuana, that may not be the only thing that may be their issue. And it may be layers to that in regards to that use and what this experience during the pandemic has been like. So no, we can't do our typical fall, rah, rah, welcome back to campus, we're happy to have you. I think we really need to put some things in place to say, hey, we recognize that, this may not have been a great year or a great year and a half for many of our students. Let's put some resources, let's put some things out there so that students have a place to go, whether that is CAPS, whether that is community resources, but really creating an environment to say, hey, we're trying to figure out our new normal, but we want to provide you with as many resources as we can to help you readjust.
Exactly. And this pandemic is for this generation and also for ours, their World War I or World War II defining change of life moment. And as we get them back, I agree with top down, but also bottom up. And we have kids, for instance, who have already made it normal to go weekly into the health center to get their COVID testing, or for the athletes 3 times a week. So they're walking through the doors. We can take advantage of that in all of our college communities to draw them in for other wellness things. I've on this panel, I've given the panelists the shared experience of my daughter at University of Richmond, where they put some of their philanthropy to work to create a wellness center that I want to go to. It looks amazing. And kids are coming in not just for illness, but for everything wellness, from massage and aromatherapy to a quiet place to study, to other avenues where people can meet and discuss a topic, as Caleb just mentioned it. When I was talking about the bottom up, in messaging, when to big tobacco, RJR Reynolds and all of the companies were supposed to create dollars to create anti-smoking PSAs, their ones, basically the implicit message was you really should smoke. But when you got teens to create anti-smoking messaging, they were hilarious, they were poignant, they were powerful, they were dramatic, and all of them had better. challenge them to say, all right, instead of hazing, could we possibly have your hazing be create the best PSA about safety, about keeping kids not getting COVID and not getting drunk and, or not using drugs, and show them the positive things they could do instead to be part of your fraternity or sorority? Can we have the other student groups, any student group compete to have the best dance party or biking marathon or whatever, walking, birding, whatever you have access to in your college community that promotes wellness and an absence of use or drinking as part of the experience of that positive holistic event. So we can tap into the creativity of kids as well, and then use the top down to help fund it or resource it to make it realities.
And Armand, can I just jump in here? I just want to sort of add something to what Ellen was saying, that colleges have at their disposal a really great way of managing this issue, and that is they offer great classes, great interactions with faculty, opportunities for internships. So maybe in addition to the health and wellness and the great opportunities to relax, they also have these opportunities to fulfill a need, an educational need and a professional need that students really need right now. One of the research findings that has come out in 2021 is that students were most stressed about how COVID has impacted their academic trajectory, and if it is going to affect their professional life. Like if all these jobs are closing down, or if the economy is going to bounce back in a different way, are they really preparing themselves? And so a college could say, you know what, we're going to offer educational opportunities to learn about a profession, or bring somebody to campus to talk about job opportunities. And so I think that they've got these things that are related to educational pursuits as well as the recreational pursuits.
Well, and this gets at something that I know a number of you have talked about, Amelia for sure, Caleb, definitely. I know we've talked about this, that the importance of that this isn't a budget question, right? We can't just throw money at this issue where, but college leaders need to be, again, personally involved. This is a policy question, not a budget question. So I guess my question to all of you is, where are the departments that college presidents need to be going to first? Which conversations they need to have now? Yeah. Who do they go to on their campus?
Well, I think student affairs and academic affairs are the two main sources from a policy perspective. And I think that by working together, they can involve making sure that people have the resources they need to have those conversations with students who might be struggling, and to create those spaces that Caleb was talking about, for both just to recognize that we've all been through something, and it really is necessary to have those conversations all throughout the fall, not a one and done. Like that there's got to be these walk-in places where, and either faculty, academic advisors, coaches would know where those places are. I think sometimes on larger campuses, you just can't keep track of those resources. But Caleb, you might have some ideas.
So I was going to say, I agree with you. I think it needs to come from academic affairs and student affairs. From an academic affairs standpoint, I know sometimes we are a stickler for rules and things have to be rigid and done a certain way, but I really feel like provosts and deans and instructors really need to come together and figure out how to loosen some things up and to give some students some grace. Again, you can't have the expectation that, students are going to come back to campus and things are going to go as is. As it's been said before, this has been a traumatic experience for everybody, but that level of trauma has been experienced differently for different students. And so to have that expectation of like, you're going to come in and we're going to do these tests and you're going to have these assignments and we're just going to roll like normal, I just don't think that's a realistic expectation. I think the other thing that also needs to be driven home is that it also does need to come from a student life standpoint, that there needs to be marketing, advertising these resources, advertising these spaces, encouraging students to use these different resources. We know, yes, to a certain extent, educational programming has its limits, but it still needs to happen because you're still going to have those students who are going to show up. And I think that also needs to come from some social programming as well, to give some students some alternatives that are healthy, that are positive, on a Friday night, on a Thursday night. I don't know about your institution, but where I went to school at, we started on Thursday nights. And so to give your students a space to have some quality programming when this is the time that they're probably going to be out drinking or the time that they may be doing drugs or socializing, maybe not in the best way. And so it needs to be a collective experience from the college to recognize, hey, this is not normal circumstances. And we have students coming in dealing with different things on all kinds of perspectives. And so I think that working academically to create some policies that are, again, not loosey-goosey, but are fair, and that are fair, and I want to use the word flexible for some students. But then again, from a student life standpoint, I'm saying, creating programming, creating marketing, creating events that create positiveness and that create healthy behavior, so that students know they have a spot and an alternative to go to.
So, Bob,
I'd like to pick up on something. There's been a long-term trend or attitude that thinks if people are healthier and happier, they're not going to use drugs and alcohol. And that is not true. It is true that unhappy people use them more, but people also use them to be happy. And what I'm going nuts about is that we're not saying clearly in this panel, it's a bad idea to get drunk. It's a bad idea to use cocaine. It's a bad idea to smoke marijuana. We're not saying that. We're in our panel saying, let's make them happier. Let's care about their stress. I understand caring about stress. I'm for that. But if we don't also say, and it's really unhealthy and dumb to do that, and you are putting yourself at jeopardy about that. So you think about partying in some way other than poisoning your brain. If we don't talk that way, in that clarity, then everything we're saying is going in one ear and out the other about this. You cannot solve the problem by having people be happier and giving them various kinds of things. It is not going to happen because the drugs work.
So I will say this to counter that, not necessarily saying I agree or disagree, but I think that socialization is extremely important.
Yes.
So one of the things that we did in CRP is we did a TED Talk style event where members in our CRP kind of gave their experience. And one of the other things that they did is that they pulled a video offline. So in both cases, 3 cases, it was a YouTube video. And then they said, this is why I chose that. This is why it resonated with me. Where I'm going with that is that a student chose a TED Talk about recovery in Portugal. And one of the things that they talked about in that is that, yes, you can say you need to abstain, and yes, we can get you away and we can get you from the drugs, and we can physically get all those things from you, but you still have to socially know how to interact with people. And that's where a lot of people struggle, because when they're in recovery, usually you're using with a certain group of people. And now that you are not using anymore, even if you're using solo, you're still oftentimes, hey, I can call this friend or this plug or whatever the case may be. And so I think it's really important that we do have events and we do worry about happiness and we do worry about their feelings in that sense, in the sense that they have to be able to still interact and they still have to be able to socialize on that campus. One of the things that one of the students told me is that he said, being a student in recovery, being on campus is a hostile environment.
Yeah,
and so
right.
you want to create an environment though where that student does not feel like other, where they don't feel like the red dot in the sea of blues. Not saying that they need to blend in, but you need to create an environment on campus where they can feel just as much as part of the campus community as everyone else.
I would build on that. And again, the messages are the right messages of you shouldn't do this. But when we say the shouldn'ts, we're shoulding on them. And I think if we can get the kids finding and generating and creating the messages and having the adults endorse and popularize them and spread them, and also have the kids spread them, TikTok and elsewhere, we can get the messages as omnipresent as don't drink and drive. All of our kids now have gotten that message. They have a DD. We want to make it normal to not even need a DD, to have it be okay to have a whole event where it's all about the fun you have without those substances, and having the with sobriety be the good thing. And so again, challenge the kids to create optimal messaging, and they can rise and shine and bring us stuff that would be really, really useful.
So actually, that kind of leads to this, a general question again for everyone is, so there's this, I'm not so sure if tension's the right word, but what can university leaders do to normalize sobriety without stigmatizing? I mean, that's those in recovery. And maybe another way of looking at it is, how important is it for college leaders to spend time with students in recovery? What's different about that environment? So we can go either direction here. Like, what do you think?
Well, I think the biggest thing that's happened in the last 50 years about drugs is the emergence of the recovery community. We have 23 million people in recovery. And I think that is a game changer. That is hugely important. And I think that we need to think about, when people talk about evidence-based policies, evidence-based programs, evidence-based treatment, we need to talk to the people in recovery about how did they get there? What was that story to that? Because that story has messages for all of us, and it's very dramatic. And what you'll find 100% of the time is when you talk to people in recovery, you ask them 3 questions. What was your life like when you were using? What happened to get you to stop? And what's your life like now? And I've heard hundreds of those stories, and they're all the same in one way. And that is that when they were using, they were miserable. They had terrible things happen to them because of their drug use, and they were completely committed to it. And then something intervened. Something happened. It wasn't that they just woke up one morning and decided this is a bad idea. Something big happened to them, or at least it felt big to them, to think, maybe I shouldn't be doing this. And then they did something about it. And that's very important to see what they do about it. And then ask them, what's your life like now? And that'll be a story, as Caleb was talking about. You go from an F student to an A student. It's the same student. One is F and one is A. What's the difference, whether they're using or not using? It's pretty straightforward to see that. And I think it's really important to be able to recognize that. I think the people in recovery are the ones who bring the message about what that life was like. And I use the term hijacked brain. The person who's using is a different, when you're using the drugs, there's more wrong with that person than that you're using drugs. There's a whole value system that go with that, a whole way of being that goes with that. And there's more right in somebody in recovery than they're not using drugs. They are a different person. They are acting in a different way. They are different character when they're very remarkable and impressive. So that's a great thing to be able to say, but you got to be able to put it together in a package of what that's all about in that behavior. And you can't walk away from it and pretend it isn't there.
I think the pandemic has made it very, very difficult for young people who are in recovery to maintain the social connections. And it has been a real struggle. And that's what the data bear out, that it's been very difficult because the connections are what promotes their sobriety. And I think we need to recognize that students in recovery are a special group of leaders on our college campuses that really need to have a prominent voice about their story and their evolution toward a life that doesn't involve substances and still is a very, very rich, fulfilling life, and that they're on their way to being personally and professionally successful. And now that the pandemic is over, they can share lessons of how they kept up their social connections, which must have been incredibly hard for them.
But it's not because they cut down on their drug use. It's because they stopped it. And that's a really big thing. People who don't know about drugs don't understand that. They think they're just drinking normally now. No, they're not drinking now. And there's a reason for that. It's because of biology. It really is important to understand that. And the reason they're going to those meetings is twofold. One is because of the character aspects of it. And the other is a relapse prevention strategy. Because at a meeting, the most important person at that meeting is the one who comes in there with 24 hours, the one who's still using. Because that's a lesson to everybody else at that meeting about their vulnerability from that. And that's really important to understand. It's zero in the people who are in recovery. It's not less.
One of the other top-down strategies that schools can engage in is how they respond when there is a crisis. I see a lot of kids in crisis. I hear a lot about what's happening on college campuses. So for instance, every kid that's propped up by a backpack from drinking, who dies, there's 20 kids where somebody said something. The most recent one I heard about from a number of patients happened at Miami of Ohio, which is 4 hours away, so practically our backyard, where a kid at a bar, which was miraculously opened because Ohio, and was drinking a ton, got brought home and propped up in his bed by the backpack. And fortunately, the girlfriend came by and found him and see something, say something, she called. And if she hadn't happened to come by, he was going to be another kid like the one at Penn State a couple of years ago who died, or ones that are other college campuses. And so I think the see something, say something, normalizing, coming forth and putting the messaging out that you're not going to get in trouble for having been at that party, or the head of that fraternity, or whatever else that fed that kid the alcohol, you're not going to get in trouble for saving his life. And the messaging to the kids has to be, do you want to live forever with the death of a friend or a family member or someone else? And the messaging for the school has to be something to the effect of, if you have a problem, we are not going to just kick you out of school. We're going to help create the resources to help you have a place in our community that allows you to academically shine and socially feel like this campus is yours. So that's a dual-fold mission. And again, incentivizing the drinking communities, which could mean the fraternities, the sororities, the social committees, whatever else, to prioritize the dance-a-thon that is alcohol-free, the volunteer service that cleans up the neighborhood dilapidated set of housing that backs up to campus, or doing things that are vibrant and thriving for the community in which that college resides, or the greater community. It doesn't matter what. So again, creating that resiliency.
Well, and Ellen, it's really important. We do a lot of work with the Maryland Collaborative to encourage environmental level strategies to reduce drinking. excessive drinking in the community surrounding the campus. Reducing access and availability is one of those evidence-based practices. And working with the business owners, the bar owners, the restaurants to make sure that before students return to campus, the bartenders are trained in over service, not to serve to an intoxicated person for legal age students, that the people are trained to card at the doors to make sure that underage students don't have access. And at those retail settings too, where they're buying alcohol, the alcohol is just pervasive. It's my friend David Jernigan says it's like wallpaper. And you can imagine that the fall of 2021 is going to be a really, really challenging time to make up a lot of profits that they lost in drink specials. And so I think the campuses need to work with those people who are in those positions, those business owners and the bar owners, to make sure that they're all on the same page to create that safe environment.
So let's go with that. So that's like, what's for, sure, please, Ellen.
I was going to say the greening of America, everybody's lithium battery and vape device or dab pen is a form of toxic waste that contributes to global warming and increases our carbon footprint in a negative way. So again, using the environmentally conscious students to create messaging around that, and then having kids have an avenue to not be penalized if they want to have a vape-free room and they have a roommate who smokes in the room. So
well, a lot of campuses have gone to a completely smoke-free policy. That's the best way.
Correct. But when the policy is smoke-free and the roommate still smokes or vapes, having some avenues that can help manage that kid up.
So we have time for about one more question before we go into audience Q&A. So what message do you have for governing boards and presidents right now as they enter this whole strategic planning process? So we are, about to hit the summer. You're going to have your annual meeting, and we got to figure out a plan for addressing this, right quick. So what advice would you offer?
So I would say one of the things that I would really advise is to increase your mental health services on campus. I understand that caps can be limited on different campuses, but coming into these times, a student shouldn't have to wait 3 weeks or a month to see a counselor. And it's going to be different on everybody's campus. On my campus, every student, if you're an enrolled student, you get up to 8 sessions a semester. And we're pretty flexible in regards to getting students in for that personal counseling. But the reason why I think that personal counseling is so important is that I'm not even just looking at addiction from a drug standpoint or alcohol standpoint, but looking at addiction as a whole and looking at students coming back from the pandemic and coming back to campus. Again, this has not been a normal time for many students. And so helping them to adjust and giving them a space to do that and to kind of help them process and figure out what kind of happened this last year and a half. One of the things that I always say in some of the presentations that I do is that no one wakes up and says, I'm going to be an addict. I'm going to be addicted to drugs. Or I'm going to be addicted to sex or alcohol or video games or whatever the case may be. What ends up happening is that thing felt good and was a coping mechanism for that moment. And it ended up becoming something more. And what I tell students and when I tell people during presentations is that that's why your mental health is just as important as your physical health. Because when you pick up other coping mechanisms, all you're doing is compounding the issue and you're not even dealing with the big white elephant in the room. All we've done is added to that by playing video games, by sexing it away, by drinking it away. And so we need to address those issues as a whole and be able to have a spot for students to come to address those things. The other thing is, it's not just as important It's not just important to have a space, but it's also just as important to create a space that is safe and that you take away that stigma. Nobody should feel like they're going through a back alley to get some help from a counselor because they don't want anybody to know. We really need to destigmatize mental health and the benefits of mental wellness on our campuses, because that's an additional issue on top of that. I can't tell you how many times students have had issues and didn't come because they didn't want anyone to find out. They didn't want anyone to think they were crazy or whatever the case may be. And so one of the things that I do in my space is I jokingly say that my office is like Planet Fitness. This is a judgment-free zone. I'm here to assist you. I'm here to help you. I'm not here to judge you. And I'm here to, if I can't directly help you, at least get you to those resources. And that's going to be one of the things that I feel that's going to be important for college campuses to do coming back this fall.
I would encourage college leaders to really look at their policies and to say, how are we going to enforce our existing policies and make sure that there's a sensible way to have enforcement where students get the help that they need when they violate substance use policies, and that training is put in place for people who interact regularly with students to make sure that they know how to recognize students in distress.
I would suggest they talk to a few students about what the normal common patterns are of drug and alcohol use in the campus, and ask the trustees to think, what do they think about that behavior?
Well, and even more than that, Bob, they've got student survey data too, as well as the more.
Again, the question to me is, what do they think about that?
Right.
And they need to say what that is. They need to tell everybody what they think about that is, because I think what happens now is it just goes in one ear and out the other because we've normalized it. That's the normal thing to do. And I think the end of COVID is a perfect time to denormalize it and say, look, this is a stressful point. Stress is one of the reasons people use drugs and alcohol. And this is a really dumb way to do it. It's unhealthy and stupid and destructive. And you need to not do that. This is not a good thing to do, but to act like it's an accepted thing and we just have to live with it and then pick up the pieces afterwards, that's not a smart way to approach a problem.
And I would bring one of my final points would always be bring it back to the kids and ask and partner with them, empower them to help come up with some of the best solutions to destigmatize wellness.
Yes, by building on the kids who are not using,
yeah,
by giving them visibility, making that the new normal. Absolutely, including the people in recovery, especially the people in recovery.
So get the message out that not everyone has done this in response to the pandemic and not everyone is doing it.
Yes, and it's a bad idea, Amelia. You're not saying it's a bad idea. Tell them it's a bad idea.
Well, but from a mental health standpoint too, it's important to say that there are really positive coping strategies that you can use that people did use during the pandemic. People took more walks, they were more active. They had conversations with old friends. Like there was this side that we learned a lot about ourselves during the pandemic, and we need to make sure that it's not all an impending doom story.
And I think that's probably one of the most surprising things that's come out of this conversation is that actually there's a lot of good that's come out of just us having to wrestle with this. So thank you to all of you. We do have a few questions from the audience. So Tracy, if you'd like to, take the first.
Yeah, sure. So we've got our first question here. I think this is something everyone could probably speak to. But we've got an audience member asking, does the age of first substance use matter? Do you guys think resources would be better allocated if they were targeted towards freshmen who may have not yet touched drugs or alcohol?
Well,
this is true. Yeah, go ahead.
Age at first use is an incredibly important variable and predicts very clearly risk of having problems. So age of first intoxication, age at first use. But what happens in college is a lot of resources are put toward first year programming. And what the data bear out is that when a student turns 21, the risk of excessive drinking really increases, and the risk of having alcohol-related harms really increase because they're 21. So I don't think that we should ignore older students, but what we should do is in the health center, and Ellen, you may want to talk about this, is a lot of clinicians don't ask at what age did you start first using? And that is a question that could be very informative in a clinical setting, because then you'll know whether or not they are at especially high risk. No matter what age you use, you're at risk, but you're especially at high risk if you started prior to the age of 18.
That's because of brain biology.
Right.
It's not an accident. And when it starts early, it shapes the brain in a different way and changes things. And that's why the goal is to have young people grow up without using these drugs. And so every year it matters. It matters if the difference between 20 and 21 is an important difference. But as Amelia said, the biggest issues are the younger ones, but it's always the case. The brain is not mature until about 25. It's not even 21. And so that vulnerability is there, but it certainly is age related.
And with the biology, if you ask a kid if they've ever blacked out when they are up and functioning but don't remember, then you can say, hey, you carry the alcoholic gene. And that means that you're going to have to either do your own personal zero tolerance approach or really do harm reduction. I just had a kid from one of our state colleges here in the office this week who regularly was drinking a couple nights a week and with friends, and it would be 6 or 7 shots. She said sometimes 8. This is a small woman, or 1 or 2 Trulies or White Claw. And I said, well, when were the blackouts? Oh, when I was doing the shots. So what does that tell you? Well, maybe I shouldn't do the shots and I should stick to Trulies. Good answer. If you're going to drink at all, if you're going to do harm reduction, then yes, 1 or 2 Trulies isn't getting you to messy or ugly phase. If you can't do a zero tolerance, at least you can do a harm reduction approach.
And you do a study of that and see what happens. And what's going to happen to that person who's got the addiction is they can't do it. They'll do it for a while and then they go off. And when that's the pattern you really want to see. You try to stop and you go back. That's your message for zero.
Right. And again, that's going to be a percentage of kids. There's other percentages where they manage the harm. And if they can't, in their own personal study, manage the harm, then you can use that in their own personal experience to say, wow, that didn't work for you. This is why you probably should be, one of the people where you make it normative to not need a DD because everyone's the DD, and create the situations where that can be a thing.
Hey, so, again, profound. Tracy, do we have anything else in the queue?
Yeah, so we've got another one here from another audience member. They're saying, I've seen several college-age students and young adults not necessarily involved with substance use during the pandemic, but they are anxiety-ridden or emotionally distressed and not understanding why. How can institutions offer resources or make sure that they are reaching students that may not even be aware of the effects of the pandemic or that they need some support?
One, make sure the resources can happen across state lines. That's something that would be a nationally useful thing. So if the kid is remote from home and home is a toxic place, they can still be leaning on their therapist or therapeutic community from that college. That would be priceless.
That's one of the benefits of COVID, because those limitations are pretty much gone as far as I know. So you can do that. I have patients who are out of state. I didn't ever have before. And I think everybody does. So I think that's a really important point.
So I think it just goes back to the point that I made earlier, in the sense that this is just a traumatic experience for many students. And so just rolling out some type of plan that addresses coming back to campus. I also love the idea of, for our students who can't come back to campus, still having resources for them remotely and online. But we really need to promote mental wellness, and we really need to promote getting assistance during this time. And so it needs to be done in a way where it's comfortable, where it's positive, where it's put out there. And again, it's not like, yo, we have these services, but you have to know where to go, or you have to know who to call to go to. But it should be something that's just out in the open for all students to know that they can use for these resources to kind of help them come back and cope and figure things out moving forward.
We've also got another question kind of in a similar vein. But this individual is asking, they're saying colleges and universities have had to develop a lot of strategies to communicate health and wellness issues to students. What are a few standout practices or policies you've seen, or how can we adapt these communication strategies to transition from the topic of a pandemic and reacting to it to just substance use, which in its own right is also deadly, but still a prevailing issue after the pandemic ends?
That is a difficult one.
Yeah.
So
maybe I think an easier way to say it might be, what are, communication policies about health and wellness that are working or not working?
Well, actually, I was just thinking, Ellen, you've talked before about this, the how college students assess risk, abstract thought versus the concrete messaging. Does that maybe play into this?
Yeah, it could. So concrete messaging is your cognitive processes that happen before basically all the way through childhood and into middle adolescence. And by late adolescence, that's when abstract thought, that ability to see consequences, happens. So making it concrete: don't drink and drive, wear seatbelt always, no vaping on campus, or, but trying to figure out the positive kick messaging that can be caught on and be part of our fabric of not just college life, but beyond, would be super, super useful. And, just that ability, and make it concrete, make it specific, make it memorable as messaging.
And we know that those sort of messaging campaigns don't really have a lot of empirical value. Like Caleb said, a lot of colleges do them, and it's sort of part of the story of what they can do. But from an evidence-based practice approach, we really need to strengthen policies, environmental level strategies that I talked about before in terms of reducing access and availability, making sure that people are all on the same page about what is tolerated and what is not tolerated. And how are you going to get students who need some help, or that a student identifies, how are you going to get them to the right resources? And how are you going to have the people in your counseling center and all across campus know how to have a meaningful conversation with the student about this issue, about either mental health or substance use? So it's more than messaging. It's more than these, like, it just isn't going to filter down to an individual student if it's just about messaging and not about policies.
The messaging has to connect to the policies, and then those asking the questions have to know to ask the right questions that get at the problems. For instance, we're doing substance abuse questions. We ask the craft questions developed by John Knight at Boston Children's. Have you ever had to cut back? Are you using to relax? Do you ever does anyone get angry, or do you get annoyed with what people's response to your use? Do you ever use to forget? Are your friends or family worried, and do you get in trouble with the authorities or the law? If any of those are a yes, that kid has a problem. And then having that linked to the resources that are not punitive, but effectively stop that behavior while empowering better coping strategies, better behaviors, coping connections, et cetera. So the messaging is the means to link to the services, to link to the policy.
Well, and this all gets this whole, the whole point of this program is that it has to be holistic. It has to it has to be a coordinated effort. You're not going to be able to throw money at a problem and just say, here it is. It's not a budget question. It is a, no, this requires the attention of, of college leadership to get all these elements in place, the messaging, the policies, the programs, and make it happen. It's I mean, truly complex. It looks like we have time for maybe one more question. So Tracy, what's next?
Yeah, so I guess kind of final question, and everyone should be able to speak to this one. I guess, can all of you just share one quick anecdote that gives you or makes you hopeful in your work, to forge better outcomes with students and kind of, end this on a positive note?
Well, one positive thing that's happened to me in the last 6 months is I've been contacted by a student organization of students that are medical school bound, and they are making addiction their topic to study and to learn, even before they get into medical school, which I think is so inspiring. And what they shared with me is they have so many friends who they think might be on the edge, and they want to learn how to communicate with them. And I think that that's just so great that they're taking this situation super seriously. So they're not students in recovery, but they're a leadership group. And I just see that as very positive.
My positive is based on when you catch kids doing something right and tell them to do more of that, you actually amplify that behavior and decrease the negative behaviors. So for instance, if a kid's getting 2 A's, 2 B's, and 2 C's, if the parent or the school is saying, well, what are you doing with those C's? The C's will come up, but the A's will come down. Whereas if you say, wow, you're 2 A's, what's going on there? And they tell you, say, do more of that, the A's stay, the B's come up, the C's come up. So in the same way with resiliency, we're asking every kid in our office and in the community, what's your COVID story? What went right? How are you gonna, this coming fall, do more of that? So catch them doing something right and help them do more of that.
I'd like to jump on that and remember on my numbers I gave you. High school seniors coming out now, 31% have never in their lives used any drugs, and 59% have not used in the last 30 days. Let's ask those people, how do they do that? How's that working for you? And let everybody see that. That's exactly, Ellen, what you're talking about. That's talking about the A's instead of the C's. And it gives everybody a model and a goal to go for.
Caleb, you have the last word.
So I would say the positive that I've seen during this time is that I've definitely seen some student groups reach out to me, individual students reach out to me, really taking their mental health more seriously. And I think that's a beautiful thing because mental health and that stigma associated with it is so negative in our country. And so I think that by taking that more seriously, we can tap into those substance abuse areas and really help students and find them where they're at and try to help them with the resources that they may need.
Well, thank you all. It's been a really informative conversation. A lot of work to be done going forward, but no playbook. But I think we have a good start here and a foundation. So thank you again to all of our panelists, and thank you all for who joined us today.
And for the panelists, I want to thank you and thank ACTA for your leadership on this. This is something you've been doing right along, and it's national leadership, and it's needed, and it's wonderful what you're doing.
All right, and this all works because, I mean, we have 23,000 trustees who are volunteering their time to answer these difficult questions, address these challenges, and that's why we exist. We're here to provide folks on the ground the resources they need. So please connect with us. We're visit our website at goacta.org. Send us an email at info@goacta.org if you'd like to reach any of our panelists or any of we'd like any resources that we have. We do have a publication on substance use and addressing issues on campus. So happy to provide that free of charge. So again, thank you all, and looking forward to speaking with everyone again soon.
Thank you.
Take care.
Thank you.